Welcome everyone, and thanks for joining us for today's webinar that's being hosted by the Tobacco Control Legal Consortium. For those of you who don't know who we are, we're a national network of legal centers based at the Public Health Law Center in St. Paul, Minnesota. And our work is focused on advancing tobacco control policy change. We're pleased to be co-sponsoring today's webinar with our good friends at countertobacco.org, which is the first comprehensive resource for local, state, and federal organizations working to counteract tobacco product sales and marketing at the point of sale. I encourage you to visit their website at countertobacco.org, which is a clearinghouse of fantastic point-of-sale information. As you know, today's webinar is focused on the different aspects of the unique entity of vape shops. My name is Mark Meany, and I'm a staff attorney here at the Tobacco Control Legal Consortium, and I will be moderating today's webinar. I'm extremely honored to be joined today by three very distinguished speakers with diverse academic and professional backgrounds. Our first speaker today will be Kurt Ribisel. Dr. Ribisel is a professor in the Department of Health Behavior at the UNC Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. Dr. Ribisel's primary research interest is the sales and marketing of tobacco products at the point of sale. He is also a multi-principal investigator of an NCI-funded grant that is collecting national data on tobacco product marketing, tobacco retailer density, and state tobacco control activities focused on the point of sale. After Dr. Ribisel, we'll be hearing from Susan Morrison. Susan has been working in the nonprofit and public health fields for over 20 years. Since 2000, she has been at the State of New Hampshire Department of Public Health, first starting as a health promotion advisor with the Division of Nutrition and Health Promotion. Then in 2006, she joined the Chronic Disease Prevention and Screening Section, working on the Tobacco Prevention and Cessation Program. Susan currently manages the state and community intervention contracts, providing tobacco educational training and technical assistance. She assists groups in policy adoption for tobacco-free college and university campuses and smoke-free multi-unit housing. Susan has presented on New Hampshire tobacco prevention projects at local and national health conferences, and is a member of several statewide and national committees on tobacco prevention and cessation. And finally, last but not least, is my colleague Desmond Jensen. Desmond is a staff attorney here with the Public Health Law Center. He works primarily on shaping federal tobacco control policy by encouraging the FDA to enact strong tobacco control regulations based on its authority under the Family Smoking Prevention and Tobacco Control Act. Desmond also educates the public health and scientific communities about the rulemaking process and highlights opportunities to engage the FDA to create better regulation. He helps the public health community in its efforts to close regulatory gaps and to enact novel regulations that anticipate future regulatory issues. In addition to that, Desmond provides legal technical assistance to members of the public health community who wish to participate in the regulatory process, and he provides litigation support to defend tobacco control policies that are challenged by the tobacco industry. So today, beginning with Dr. Ribisel, who will be discussing the latest published research on vape shops, and he'll also introduce a new retail assessment tool that's designed specifically for vape shops. Next up, Susan will talk about research on vape shops that they conducted in New Hampshire and some of the interesting things that she learned from the data. And then finally, Desmond will be discussing state and local policy options in light of the FDA's deeming regulation. And as Cameron said earlier, we will be reserving some time at the end for questions, so feel free to type them in as they occur to you as we go along. And without further ado, I'll turn this over to Dr. Ribisel to get things started.
Great, thank you very much. I'm very excited to talk with you, and I do have two different presentations I'll be giving. And so the first one is a systematic review that my colleagues and I are doing, where we've scanned the literature comprehensively to look at all studies published about vape shops and then some of the things we've learned about that. And then secondly, talking about an instrument that people who are local and state practitioners can use to assess what's going on with the sales and marketing practices of vape shops, called the V-STARS assessment form. And I'll show that to you, and it's been publicly released. I'd like to acknowledge our funding for this work has come from CDC, the Prevention Research Centers program, as well as the National Cancer Institute, funding our counter tobacco work and our NCI grant. The systematic review is done with my colleagues, Joseph Lee, Ellie Orlin, and Terry Sewell. And Joseph Lee is the lead author on this, but he's unable to present, so I will be presenting the systematic review of vape shop research. So we know if you look at data, this is Google Trends in searching for the term vape shops. If you just input that term, there are more and more search queries over time. So there's been rising interest in the idea of vape shops, and we all know they're a hot topic. We have over 240 people registered and participating in this conference today, which is more than many of the past ones have had, and there's just great interest in this topic. So what we wanted to look at in our systematic review is how do people find, identify, or map vape shops, and what are some of their sales and marketing practices? And also, we'll be looking at some of the beliefs of vape shop owners and clerks. All right. So for our systematic review criteria, these are studies of retailers that sell what are called ENDS, electronic nicotine delivery systems, or e-cigarettes, vaping devices, or juices and liquids as a major product. So we're trying to find the retailers. We're looking at their sales and marketing practices, any disparities related to the neighborhood characteristics of the neighborhoods that they're selling from. We did not look at retailers where e-cigarettes are just one of many products, like a gas station or a convenience store, or studies of consumers, people who vape the product or use the product. And because of and our dates go through January 2010 to June of 2016. We have updated, I guess one study, there's been one or two new studies. We just reviewed about 20 every week come in that are potential studies, but only one or two meet the criteria typically in a given week. So we start with over 9,200 records using a series of terms that we input into multiple databases like PubMed and PsycInfo and so forth, using words like vape shop, vaping, e-cigarette retailer, and so forth. We remove duplicates. When we get down to the full screening criteria, we had 12 studies that met our eligibility criteria. And so what I'll be talking about is based on those 12 studies. You can see over time, they really took off in 2014 and 2015 in terms of the vape articles. We assume, too, that we'll hit a point this year and next year where there will be a lot more studies. Most are coming from the U.S. As you saw, one came from Canada and one from Korea. So there are multiple methods that people have been using to find vape shops. Those of you who are from a local or a state group know that there are many ways that you can find these vape shops. We'll talk about a couple on an upcoming slide in which ones appear to be the best. So 4 studies have addressed that particular topic, 4 on the sales and marketing, and then 4 on the attitudes and beliefs of the vape shop owners. So with the rise of vape shops, I'll start off right now. I don't think we have a great number as to how many vape shops there are. From some work that we're doing off of an NCI study, we know there are about 274,000 cigarette retailers. We don't really have a great number, but here are some of the things that came up in the search that we had here. There was one, and again, these are not. This is the only time I think I'm mentioning something that's not coming from our systematic review, except for that last study. The first one was a Bloomberg article that said there are at least 3,500. In 2014, using this one trade association estimates there might be 35,000, and that may be a reasonable number in terms of what's out there. I think that we're definitely in I think more than the 9,900 that were found in this one study that had shown also an increase. I think anyone who's been in tobacco control or seen this has tracked really a very, very sort of large uptake in the number of shops. This is an area that I think people need to do more work in to identify how many there are. These are some of the ways that people have identified the shops. Yelp has been one of the most popular ones. Several studies have used this, and one study accumulated Yelp data from all kinds of cities and put it all together. That probably, and one of my colleagues has done a study that suggests that Yelp may be the best single source. If you could do one source, that may be your best source if you're looking to identify them in your community. But Google Maps, white pages, search engines such as Vape search and so forth are good. Again, going counterclockwise, licensing lists have not been as useful because many places haven't yet licensed vape shops. They have to amend their tobacco product definitions and licensing rules. In some states, over a dozen states, don't have licensing. But if you do have a licensing list, that's an excellent place to go as well. Ground truthing is really the gold standard way of doing it if you're able to, and that is driving around on all primary and secondary roads where there would likely be businesses in a community. It is very, very time intensive, and if you're doing something at the state level, it's impossible to ground truth given the amount of driving. But when people are doing a study of a city that has anywhere from 20 to 100,000 people, you can, with a few days of ground truthing, actually cover almost all the primary and secondary roads and probably find them that way. And lastly, Yellow Pages has identified some. And people are also combining multiple sources as well. That's been the norm, I think, in most of the studies that we looked at. They did use multiple sources and combine them. One of the first things that Giovenco and colleagues found is that the vape shops are often clustering in areas where there's high tobacco retailer density, which we think is a proxy for higher smoking rates. And this makes a lot of sense. If you look at the data on dual use, we know that the majority of people who are using an e-cigarette are either current smokers or former smokers. There's a really high use rate among that. Now, most smokers are not current e-cigarette users, so that the opposite is not true. But so that makes sense that we're seeing more vape shops in areas where there's greater numbers of retail outlets. But in contrast, there's sort of a reverse disparity, whereas we have these disparities of cigarette retailers that they're more likely to be in African American neighborhoods, in areas with lower income populations. There are fewer vape shops in those areas, in some of the minority areas. And we saw that 2/3 of colleges had a vape shop within a 3-mile radius. So there also appear to be more, the vape shops are overrepresented in college communities, especially where there are private colleges. And then on the right, you can also see the reference in the Giovenco study. The reference community is the highest income community. It had far fewer vape shops than lower and medium income communities. Some of the sales and marketing practices, we have not yet seen major chains taking over. I know this has been a lot of businesses are trying to become kind of like the analog of the Starbucks of the vaping industry, where they're going to have a sort of a national presence. At the moment, there have been many of the places use smaller budgets and alternative marketing strategies to market their products. There's a great paper by Cheney that talks a little bit about all of the different types of techniques that people are using. And a number of people are using like reward cards and customer loyalty programs, which have been you see with other products as well. When you look at what the owners believe, many of them, there have been several studies of this, and we're citing just sort of illustrative quotes of it, but a lot of people believe that the vape shop believe that they're completely safe, and I think when you look at the prevailing views in tobacco control, I think people wouldn't say they're completely safe, but I think people would say they appear to be, for an individual, less toxic certainly less toxic than a cigarette. People mention, their doctor sending them to a vape shop. There are some examples here where people talked about products as being containing FDA-approved ingredients or food ingredients or the food grade additives that are generally recognized as safe. And again, the caveat there, as many people know, is that many of these food flavorings and so forth are viewed as safe for ingestion but not inhalation, and so there's that's sort of a key distinction. Many of the vape shop owners are former smokers and are very excited about the fact that they were to quit smoking. They're very anti-smoking, and talk about how their health is improved, and that's sort of a key theme you see in many of these studies. When you look at some of the products sold, some of the nicotine solutions are mislabeled when you actually do a chemical analysis of what's in the actual liquids. At times it's more nicotine, at times it's less. This has been a theme we've often seen, and I think with some of the FDA regulation, there'll be better, I think, product testing and accuracy of whether the product, and there's also been studies that have shown, they weren't in this review, but there have been other products where they've shown that products that are advertised as containing no nicotine actually did, and ones that were nicotine, that had nicotine, some of them didn't. So there's some room for improvement, I think, in some of the quality of the accuracy of the labeling. So in conclusion to the systematic review, there's a wide variety of strategies. People are often employing multiple ones to find the vape shops. We believe that the number of vape shops is growing significantly over time. They're using low-cost options to market their products. And many of the vape shop owners are customers themselves, are often using the product during the interviews with the researchers, and believe it's a much lower risk product. And we believe that FDA regulation may affect the growth. So, all right. The one thing I would just note about when I presented the number of shops, if you looked over time, one of the estimates that was more recent had a 9,900 number, but an earlier number from the prior year had a higher number, 33 or 35K. They're done by different projects, but I definitely think we're way over the 10,000 number. I don't want to, because as a researcher, I try to base all my estimates off of empirical stuff and not just hunches and so forth, but I can say that I think from other sources I've seen, it seems pretty clear that we're well above that 10,000 number, and that you need to look within the study and use the same methodology and look at the growth trajectory because they were using different approaches. All right, the second piece I was going to talk about is this V-STARS assessment form. It's modeled after something, our standardized tobacco assessment for retail settings, and this is the vape shop version. It's a group effort. We have a team of folks led by Lisa Hemmerson, who is the chair of the retail work group for our Funded in the State Community Initiative by National Cancer Institute. And we have multiple pilot sites that I want to point out. We want to thank them for taking a draft form and testing it out, giving us feedback, and helping us improve it. So we have what I'm presenting here as a beta form, but hopefully you'll find it helpful. The STARS form has been used now in over 30 states, so it's getting sort of widespread utilization. It replaces, I think, Store Alert and Operation Storefront and some of the prior store assessment forms. And the idea is to look at some of the products, flavors, placement, promotional strategies being used. It's really informing policy change. It's more to look at things that could be done in the future rather than looking backwards about enforcement. And it's meant to be user-friendly and conducted in about 10 minutes. Anywhere we've been seeing between 8 and 12, most groups can do this form. It's a one-page front and back, both for the STARS, the original form for cigarettes and other tobacco products, as well as V-STARS, the vape shop version. Both of them are sort of similar. This is a map showing the states with the checks. People are currently or planning to use STARS in those states in the very near future. And 97% of the people who we surveyed who use STARS says they want more questions about vape shops and electronic smoking products, so that's why we created the V-STARS form. So I'll be showing some of the questions, some of the questions that are on the assessment form. So here's one about what are the age policies. As you all know, many state and local communities, if you're in Hawaii or California, you have tobacco 21 policies, but you would match basically whatever the age policy is in your community and track whether there's clear signage. And you'll see that the presentation coming right after me by Susan on the New Hampshire will have data on some of these questions, whether they're selling psychoactive substances, including alcohol, marijuana, the whippets, whipped cream chargers, so forth. the types of vaping systems sold, whether they're the early first-generation cig-like devices to the more complicated and modern devices like RDAs and RDAs, and dry chamber devices, which people are also putting loose leads in and combusting. The liquids and juices, we're tracking flavorings and whether they're nicotine-free or not, as well as containing caffeine and other products. And whether they're in a self-service display. As we'll hear in a moment, there are self-service bans on cigarettes and smokeless, but there aren't self-service displays on the e-liquid, so consumers can often pick them up and they're available. There's also messaging that can appear in the store, and whether or not there's the suggestion that vaping is safer than cigarettes, whether it helps you quit smoking, and whether it's a cheaper alternative. So this is some of the messaging that you can track, and we do have a whole form that helps give you details about how to operationalize these, and tracking whether there's the presence of some type of a rewards or loyalty program. And then towards the end of the survey, it's mostly designed to be something that's observational, where a person will go in. In most cases, you introduce yourself to the vape store owner or manager or clerk. They've generally been very good about letting people look around the store and tracking what's going on. I know we do have over a dozen people from vape shops on the call today. And so I thank folks who are in the vape shops for really being very open and transparent, allowing folks to track what's going on and learn more about what's going on in vape shops. And then there's tracking about, are they mixing liquids on site and our store staff doing it, and do they allow customers to do it? Some people have asked questions about whether people are using gloves or not. That's the kind of thing you can add if you would like. So the form is meant to be supplemented with questions that are useful in your local community, and it's meant to be short so that you can add, if you want to add 1 or 2 more minutes worth of questions, and you'll see in a moment that Susan Morrison, they decided to add some questions. So that's my summary of what the V-STARS form is, and I believe we're going to take questions all at once at the very end. Thank you.
Great. Thanks, Kurt. Hello, everyone. I'm happy to be a part of this panel and share with you some of New Hampshire's experience. First, I'd like to share a bit of New Hampshire. Population of 1.3 million. New Hampshire has 400 legislators. Yes, I did say 400, the majority of Republican. They are elected to a 2-year term, and for reward of their service, they are given an annual salary of $100, a special license plate, free tolls, and mileage reimbursement when traveling on state business. Kind of interesting. We also are a preemption state. We were known for the old man of the mountain, yet he fell in May 2003. Our state motto, and also appears on our license plate, is live free or die, which equals no sales or income tax. So all of this kind of keeps my job in prevention a little interesting some days. But the last point is the ability to travel from one side of our state to the other in a few hours, which this, as I talk down the road in my slides, you'll see it makes it easy for us to be able to do a statewide sample. So the case study came about back in October 2015, the Tobacco-Free New Hampshire, which is a network of community partners interested in tobacco issues, connected the Tobacco Prevention and Cessation Program, requesting New Hampshire vape shop data to educate the New Hampshire legislators in the upcoming season. So the program staff got busy trying to do some research and came up with very little information. At the time, New Hampshire, a person only needed to apply for a certificate of good standing with a fee of $5 or $25 if you wanted to expedite that license for an LLC to open a vape shop. Tobacco license is only at that time needed if the shop planned to sell tobacco products. Finding an accurate list of locations in the state, as Kurt mentioned before, was a bit of a challenge for us. A list was started by searching online websites, Facebook, Google, Yelp, and just word of mouth from other store owners. program considered visiting a sample of shops on this list and gathering data to share with partners. But at the same time, I had reached out to the Counter Tobacco org for possible tools for surveillance and found out that the University of North Carolina staff were in the process of building a new STARS tool for vape shops. And after a few calls with the staff, we decided that we would like to help them and pilot the new tool. Over the next few months, we worked together in editing drafts of the tool and to come up with a plan on the pilot project. In January 2016, 75 of the final list of 80 shop locations were visited by a team of 2 staff members. In total, 55 V-STAR surveys were completed. So the difference of the 20 locations were either no longer in business when we arrived, or at the time were closed at the time of the visit, or would not allow a survey to be done. So this is a GIS map of the New Hampshire vape shop locations, 80 locations as of February 2016. You'll notice that the majority of the shops are in the lower part of the state, which also includes the higher populated and bigger city areas. So here is some New Hampshire data that was compiled, availability of e-cigarettes. You'll see that the majority of the shops sold both types of models, and very few Cig-a-lights were sold in New Hampshire. So the availability of e-liquids and cartridges, we noticed that the majority of the shops sold e-liquids versus cartridges, and that the majority of the shops sold all types of candy, fruit, menthol, mint, and nicotine-free options. Sampling inside of the stores, notice very little mixing was done on site. Most of it was bought pre-packaged e-liquids, and almost all shops in New Hampshire had child-resistant packaging. I'd also want to share a little bit, as Kurt mentioned, that New Hampshire partners were interested in collecting some additional data that was not asked on the final V-STAR form, and UNC added an additional page to the pilot form to make sure that we got the data that we wanted collected. And that included e-liquids in a pricing range. We were just curious to see how much things cost. So a cost on average for $5 to $40 for a 10 to 60 milliliter size bottle. Cost an average of $65 to $80 for a 100 to 180 milliliter size bottle. And one shop sold a bottle 480 milliliter for $120. We also were interested in the size bottles that were sold. Shops sold 10 milliliters to 480 milliliter size bottles. Over 50 shops sold 15 to 30 milliliter size bottles, most popular. 26 shops sold 120 milliliter bottles, and 11 shops sold 180 milliliter bottles. We had one store who sold a bottle 340 milliliter, and one other shop that sold 480 milliliter bottle. We also were interested in the nicotine concentration that was sold in our state. So shops sold 0 to 36 milligrams of nicotine. Over 50 shops in New Hampshire sold 0, 3, 6, and 12 milligrams. Over 25 shops sold 1.5, 18, and 24 milligrams. And we had only a few shops that sold the 30 and 36 milligram size bottles. This project was an eye-opening experience, very educational for the program staff to see what kind of products were out there in our state. in general, New Hampshire felt like the survey flowed very well, and once familiar with the questions, surveying went very quickly. Program staff found that it was easy to engage with the shop staff from the start. Walking into a store with a clipboard kind of, sends up a red flag, so we kind of announced ourselves from the beginning, and the amount of products in the store can be somewhat overwhelming if you're not familiar with them, so it was helpful to be able to ask the staff some of the questions to complete the survey versus spending a lot of time searching for the answers ourselves. We did find that language is very important. We were told by many shop staff that if we came into the store as a customer and asked if the shop sold bongs, we would have been immediately asked to leave. I'm not sure if that is just a New Hampshire thing or not, but it's something I think they removed from the final draft of the V-Star form. Many of the shop owners we talked to were very anti-tobacco, but they also then stated that they thought vaping is safer than smoking. We had learned that trying to keep an up-to-date vape shop list is like trying to hit a moving target. I am aware right now, so months later since we did the surveillance, that at least 8 shops in our original list are now closed, and I have no doubt that there's just as many new ones that have opened up, if not more. So in closing, the V-Star pilot project turned out to be a great experience for New Hampshire. It allowed us to collect valuable data we can share with our community partners and educate our legislators. And we want to thank the staff at UNC for a great partnership. Thank you.
All right, thanks, Susan. I'm going to be talking about vape shop regulation. And the best place to start that discussion is with the FDA's recent deeming regulation that extends the agency's regulatory authority over e-cigarettes. Before we dive into the requirements and the restrictions that the regulation imposes on vape shops, I want to make sure that we're all on the same page as to what the FDA regulation does and why the agency had to do it. The FDA's authority to regulate specific tobacco products is governed by the definition of tobacco product in the Tobacco Control Act. Now, there are 2 important parts to that definition. First, the FDA can regulate products that are made or derived from tobacco and intended for human consumption. Now, it's broad language and it would essentially capture any product that's currently on the market. The second part of that definition provides that the components, parts, and accessories of tobacco products are also included within the scope of tobacco products. It may not be 100% clear from the way this is written, but that means that even if a component, part, or accessory is not itself made or derived from tobacco or intended for human consumption, it is still a tobacco product by virtue of the fact that it's a component, part, or accessory of a product that is made or derived from tobacco. As I'm sure you all know, since 2009 when the Act passed, the FDA has only regulated cigarettes, cigarette tobacco, roll-your-own tobacco, and smokeless tobacco, because the Act gives the FDA immediate authority over those products. For any other product that meets the definition of tobacco product, the FDA has to take an affirmative step and deem the product to be subject to the Act. The statute uses the word deem, hence the name deeming regulation. That's really all you need to know for background on the deeming regulation, so let's talk about exactly what products are being regulated. Now, remember that the definition of tobacco products includes components, parts, and accessories of tobacco products. And the FDA has the authority to deem any products that meet the definition of tobacco products. So with the deeming regulation, the FDA has deemed all products that meet the definition of tobacco products, and the agency has decided to deem components and parts of tobacco products, but they have not deemed accessories of tobacco products. Now, without any definition for those terms, it's not clear exactly what the repercussions of that decision are. And when the FDA proposed this rule back in 2014, the agency proposed a similar scheme, but they did not provide definitions for those terms. As you can imagine, the FDA received many comments urging the agency to establish definitions, and the final rule does include definitions. I won't read the exact language. The FDA is using the terms component and part interchangeably, and those terms refer to something that can alter a product's performance or is used for the consumption of a product. And then the definition specifically excludes accessories. An accessory is not used for the consumption of a product and either is not intended to affect the performance of a product, or if it does affect the performance, it's only for controlling moisture or initiating combustion. So those last two parts of the definition are clearly intended to capture cigar humidors and matches and lighters. So the definitions give us some idea of the distinction between those two categories, but luckily the FDA also provided a list of examples of each to give us more information. So for our purposes, all of the different parts and pieces of e-cigarettes are components and parts. I've highlighted them so you can run through the list, but essentially anything that you can put on or take off a device is a component or part. The same is true for hookah, and they've also included some of the packaging for single cigars. As for accessories, you have things like special screwdrivers to assemble e-cigarettes, ashtrays, spittoons, and humidors. Those products, accessories, are not deemed, and so the FDA will not be doing any regulating of those products whatsoever. And it kind of makes sense. FDA regulation of ashtrays really wouldn't create any benefit to public health. So let's talk about the actual restrictions and requirements that are placed on the products, their components and parts, the manufacturers and retailers. There are two sets of requirements and restrictions that we're going to talk about. First is the statutory framework. All of these policies are written into the Tobacco Control Act, and by virtue of the fact that the FDA extends its authority over a product, all of these policies will automatically take effect. The FDA cannot pick and choose which policies apply to which products. These policies apply to all products as well as their components and parts. As you can see, some of these requirements have already started to go into effect. Others will take effect next year, and still others are phased in over the next few years. We'll revisit some of these in just a minute. The other set of requirements and restrictions make up the regulatory framework. These are the policies that the FDA can establish and amend. So here the agency is allowed to make regulatory distinctions between products, and you can see that they have. With the exception of warning labels, which go into effect on August 8th of 2018, these policies went into effect on August 8th of this year. Now, we have to put a big asterisk on this information because the regulatory framework does not apply to everything. Remember that with the regulatory framework, the FDA can make decisions, and the agency has decided that these policies only apply to tobacco products and their components and parts that are made or derived from tobacco. So the minimum age and warning label requirement, as well as the vending restriction, do not apply to e-cigarettes that are sold without liquid containing nicotine. I have specifically not mentioned sampling in this context because there's actually an asterisk on the asterisk that we'll circle back to in just a minute. But first, let's talk about actually what restrictions and requirements in the deeming regulation apply to vape shops. And first, we'll revisit the statutory framework. You'll notice that many of these requirements seem like they would be imposed on manufacturers, which really isn't surprising. Manufacturers have things like information on ingredients and health documents, and they're often responsible for most advertising. So pre-deeming, it was pretty easy to tell who the tobacco product manufacturers were. In the cigarette market, there are a handful of companies that control the vast majority of the market, and there are essentially no mom-and-pop manufacturers. However, the e-cigarette market is very different. According to the Tobacco Control Act, if you manufacture, fabricate, assemble, process, or label a tobacco product, you are a tobacco product manufacturer. Again, cigarette manufacturing happens in factories, and retail stores don't do any of these sorts of things. However, many vape shops mix liquids, assemble and customize devices, and also create labels for products. They are doing all the things that make one a manufacturer under the law. So this is another case where the FDA responded favorably to comments. The proposed deeming regulation had no mention of regulation of vape shops, but the final rule indicates that if a business is mixing liquids or fabricating devices, that business is a tobacco product manufacturer. From a legal perspective, this is a common sense application of the law. Because e-cigarette liquid and devices are tobacco products, if you're creating or modifying these products, the law dictates that you're a manufacturer. And anyone who is a manufacturer is responsible for the statutory requirements related to their products. So this is the stuff from the first table again. All of these requirements apply to each product that a manufacturer creates, which includes each different version of an e-cigarette liquid by nicotine concentration and flavor. So for some vape shops, that could be hundreds of products. So vape shops that mix liquids and build devices will essentially have two choices. They can continue their business practices and submit to FDA review of their products, or they can simply stop mixing liquids and building devices and only sell prepackaged products. And this is what the FDA expects to happen. The agency assumes that most vape shops will move to a pure retail model where they cease the activities that run to the manufacturers, relieving them of the burdens placed on manufacturers. That means that most of the statutory requirements will no longer apply to them, only the regulatory restrictions. Now, this isn't required. Vape shops can continue to be manufacturers if they choose to. They just have to comply with all of the statutory requirements. In either case, vape shops must comply with the regulatory requirements. You may recall that most of these, the regulatory requirements, are point-of-sale restrictions. And because they relate to the business transaction of selling a product, vape shops cannot escape these restrictions by changing to a pure retail model. So there will still be a minimum age to purchase tobacco products, vending machines will still only be allowed in adult-only facilities, and free samples are prohibited. Okay, so now I want to say a few things about free samples because it's been one of the most frequent questions that we've been receiving since the final rule came out in May. It has been and continues to be a source of confusion. And vape shops, more than other tobacco retailers, use sampling as a marketing tool, and there are a variety of different product types that can be sampled. So we'll dive a little bit deeper to understand how the FDA is regulating free samples. This is the language that prohibits the distribution of free samples. It's pretty straightforward for the most part, but there are at least two immediate follow-up questions that come to mind. First, what constitutes a free sample? And second, which products exactly does this cover? So we'll take the first question first. According to the agency, you are allowed to smell and touch a product, but you cannot consume the product in whole or in part, so even one puff, and you cannot leave the store with a free product. Now, it's fairly common sense. The one lingering question might be the threshold for what constitutes free. We've been hearing about retailers that are now charging nominal fees for samples, and we have yet to receive clarification from the FDA on whether this activity is prohibited or not. So we can't actually answer that question today. The other big sampling question is which products are covered. If you remember a few minutes ago, I told you that sampling was the asterisk on the asterisk because for all of the other point-of-sale restrictions, the FDA made a clear distinction between which components and parts were covered and which weren't. The other point-of-sale restrictions, besides sampling, apply to tobacco products and their components and parts that are made from tobacco, but not to those components and parts that are not made or derived from tobacco. I did not tell you why sampling was different, but I will now. Now, if you're slightly tuned out, tune back in with your full attention for just a minute because you're about to see a really good example of why definitions are so important in the law and why it's not clear whether the FDA will be enforcing the prohibition on free samples for products that don't contain nicotine. Again, this is the sampling prohibition, and you can see that the products that it covers includes other tobacco products. And when I showed you this before, I left off some of the language that wasn't relevant to the earlier discussion. So here's the rest of that language. The definition of the term tobacco product references back to the Tobacco Control Act definition. And all of this language was already in the FDA's regulations before the deeming regulation. And this prohibition on sampling is the only spot that already referenced products that weren't actually yet subject to FDA regulation before the deeming regulation. And the FDA didn't amend this language with the deeming regulation. All of the other point-of-sale restrictions were first established by the deeming regulation, and the FDA created the term covered tobacco products specifically for those restrictions. So the other point-of-sale restrictions apply only to covered tobacco products. And with that definition, the FDA has essentially exempted non-nicotine components and parts from those point-of-sale restrictions except free sampling. Because the sampling provision doesn't use the term covered tobacco products, it uses the term tobacco product. And as I just said, it references back to the Tobacco Control Act's definition of tobacco product, which you may remember from the beginning. It includes anything made or derived from tobacco, but it also includes all of the components, parts, and accessories of those products that are made or derived from tobacco. Now, the FDA didn't deem accessories, so accessories are still outside of FDA regulation entirely. But the sampling prohibition applies to all tobacco products and their components and parts without any limitation on whether or not the components and parts are made or derived from tobacco because it uses this broader definition. So we know that the FDA has the authority, but has the FDA clarified how they will enforce this provision? The answer is not quite. the FDA has said that a nicotine-free e-liquid can still be a component of a tobacco product. They recite the definition of component as a reference, and then they note that they'll evaluate products on a case-by-case basis. So we await clarification or an enforcement action by the FDA to actually see what the agency does. So let's move on to state and local regulatory options. The most powerful tool, and the most powerful state and local option to regulate vape shops is licensing. Licensing is such a powerful tool, in fact, that I'm not actually going to really discuss anything else, because just about any policy option that you can think of in tobacco control, with the exception of taxation and the creation of comprehensive smoke-free policies, most other policies can be rolled into a licensing scheme. Licensing allows the government to regulate the who, what, where, when, and how of businesses. So licensing requires that anyone who wishes to do a specific thing get permission from the government first, and the government can set limitations on that regulated behavior. So just as a driver's license gives you permission to drive a car, but doesn't give you permission to drive your car anywhere or as fast as you want, retailer licenses provide an easy way to control certain aspects of the tobacco retail environment, such as prohibiting licenses to pharmacies or only granting licenses to facilities that don't allow anyone under 18 or 21 to enter. Licenses can limit the type of products sold, such as prohibiting all combustible products or all flavored products. They can limit where retailers can operate, such as within a specific distance from schools, or limit retailer density by prohibiting a retailer from being within a specified distance of another retailer. Licenses can limit the time of tobacco product sales, such as when children are going to and from school or during recess. And finally, licensing can also regulate the types of transactions, such as establishing minimum prices, prohibiting certain types of price discounting, or establishing minimum package sizes. These are all just a few examples. Most of the foundational and novel policies that you can think of can be put into a licensing scheme. And there are many benefits to using a licensing scheme. Because all retailers must get a license, it's easy to identify retailers for enforcement purposes. Because licenses require a fee, some enforcement costs can be deferred. And licenses allow for the creation of unique penalty structures, with the most effective ultimate penalty, the revocation of the license to sell tobacco products. Now, there's a lot to consider when implementing a licensing scheme, and anyone thinking about it can call us for help. We have lots of resources on licensing on our website. We also have lots of resources on the deeming regulation if there are lingering questions about that. So I'm going to turn it back over to Mark so that we can start getting to questions.
Great. Thank you very much, Desmond. And thanks so much to Dr. Ribisel and to Susan. Three fantastic, unique, but complimentary presentations. I think this has piqued quite a bit of interest, and we have a few minutes for questions. So I will just shoot some of those out right now to some of our panelists here. The first one, I think, is to Dr. Ribisel. The question is, first of all, where can they get a copy of the V-STARS questionnaire? But also the second is whether there is any section on that would address cannabis oils or other marijuana products, or I guess perhaps whether that could be added on, as Susan mentioned, was done in New Hampshire.
Yes, so the V-STARS instrument does contain questions about the types of products, are alcohol sold, marijuana sold, and so forth, as well as questions about do the liquids contain THC. So yes, there is that. There are those questions in there. And one thing it brings up a point too about what is a vape shop. There are purist definitions that some researchers and groups only define a vape shop as a pure standalone vape shop, and if it sells either cigarettes or has anything that's considered what's part of a head shop, they absolutely don't consider it a vape shop. I would just say that each person makes their own determination on it. In my own personal research, I have a more inclusive definition that includes the pure vape shop that everyone agrees is a vape shop, that's vape only, e-cigarettes only, and hybrid ones that do have head shop, that do sell other products. And including some that sell cigarettes and cigars. So some people would not include that, but in my work I do. If you want the V-STARS instrument, it's available on countertobacco.org. Again, all one word, countertobacco.org. And there's, you could just hit the search for V-STARS or look for store observations or store assessments, and it's right there. It's also in our news as well. Thank you.
Great, thanks, Dr. Ribisel. We have a couple questions I think I can kind of combine here that I think are probably most directly relevant for Susan. The first certainly is, and it's what types of shops, kind of what Kurt was saying, were included in your assessment in New Hampshire. And then also, as you mentioned, that there was quite a bit of shops opening and closing during this time, whether you saw any market consolidation during this time, meaning individual shops buying other shops, you know, kind of creating the chains that Dr. Rubis also talked briefly about earlier.
Sure. So the first part of that question, yeah, we did more than just, we were using Vape Shop as a total overview, but we did, you know, do vape kiosks, smoke shops, and also we did have a few head shops in New Hampshire. So it was an inclusive, multi-categorizal survey. And then we did see, you know, it's funny that you mentioned, we did see some turnover. I don't know if it was happening during the time we were doing the survey, but shortly after, we did see that some of the same names were appearing, buying out others and kind of forming more of like a chain-like in several different locations in the state. So we did see some of that happen, yes.
Perhaps I could answer as well. We have also seen a decent amount of turnover, more so than you see with cigarette retailers over time. So I think it's a little bit more of a fluid industry. I do think that with the barriers to entry to running a vape shop have been fairly low so far. With the FDA's regulations, they got a little more restrictive. I don't think it's going to have too big of a dent in the short run. I think when you look at the news articles or that read the things on Vape Shop News and Vape Shop periodicals, there's talk that 99% of stores will all go out of business, 99% of the products will be off the market, and so forth. I do think that, as was mentioned by Desmond, there will be people who likely, there will be manufacturers who likely go through the product pathways to get approved. It is expensive. There are estimates of how much it is, but it's definitely going to be over $1 million. And if you're selling multiple products with approvals, you know, you may spend 5 to 10. So I think that's going to force a couple of things. People doing that retail-only model and not doing a lot of mixing. So I think within 1 to 2 years, we're going to see mixing going way down, or you're going to see just bigger places allowing that. And I think you're also going to, some of the consolidation here, there's a group called Avail Vapes that's in the southeastern U.S. They're in North Carolina and multiple other states. They appear, I think that this tighter regulation is going to favor larger enterprises. So I think we're going to see more of that kind of, I think we'll see growth in the industry, not retraction. And I think people are just going to be switching their business model. That's just sort of my thoughts on that.
Great, thank you. Our next question is, I think, directed toward Desmond here. And the question is, what are some of the key regulatory gaps left in light of the deeming rule so far, specifically related to flavored products, whether that's something that can be filled more appropriately at the state and local level?
Yeah, that's a good question. I would say, generally speaking, what we have been telling people who are doing work in their state and local communities is that, you know, really nothing that the FDA has done with the deeming regulation should slow your momentum on doing whatever you're intending to do at the state and local level. There is nothing in the deeming regulation that prohibits flavored products specifically. The FDA noted that they do intend to issue a product standard related to flavors and cigars at some point in the future, but the FDA's processes are very slow, so that's, you know, several years away at best. There's also a possibility that the FDA does some work to limit or probably not eliminate, but limit flavors through the pre-market review process, but again, that's a process that's being phased in over the next several years. So nothing, if you're intending to work on flavored products in your community and you're thinking, well, maybe we don't need to do it now, if you were intending to do it this year or next year, I would keep doing what you're doing. And we have a few fact sheets on our website on the deeming regulation, and the one I would just flag for people is called State and Local Tobacco Regulation in a Post-Deeming World. That sort of lays out where the gaps are and also where the FDA doesn't have authority to act. So the FDA can't do things like raise the minimum age to 21. So all the communities that are working on that, that's something that would never be supplanted by FDA regulation. So there's a good list of that kind of thing on our website, and also, of course, if you need help working on tobacco policy, that's what we're here to do.
Great, thank you. Well, we have reached our time here. I was going to see if we could have maybe just one more question, if everyone will indulge me for just a minute. I know there's one question just, and sorry, Dr. Roseline, I asked you to put on your futurist hat here a little bit, but there's a question about since the research really seems to be kind of in its infancy on vape shops, if there are areas you see that will be getting maybe clarified more in the near future, if you see anything that's coming up shortly in the research realm.
Yeah, I think really watching how everything shakes out with the upcoming FDA regulations is really key. I think we're at a really critical point where the regulations. I've written a paper where I'm a fan of proportional regulation. That is, we take the most dirty, dangerous, toxic products like combusted cigarettes and little cigars and give them the most stringent regulations, and then we give less stringent for cleaner nicotine delivery products. I think e-cigarettes have room for improvement from a manufacturing standpoint and some of the sales claims and so forth, but I do think once properly regulated, they will have lower risk. Again, not risk-free, but lower risk, and I think they should have a slightly less onerous regulatory environment. And so I think tracking what happens with FDA, hopefully things aren't they're not overcorrecting, and putting and hopefully we will still see a thriving sort of community creating products that are going to be lower risk and almost minimal risk, which would be, I think, would be a fantastic goal. I think that's the thing to watch. There's one final comment I would just make on flavors. Someone wrote a comment about flavors. These are really, flavors are one of the thorniest, toughest issues, I think, because flavors appeal to several groups. One, they appeal to youth. That's very, very clear. But they also appeal to adults. And adults, if they're going to be switching over, ideally they should be quitting tobacco use altogether, but if they are quitting to use an e-cigarette, many of them want a flavor. And so, but some of these flavors are dangerous, like the popcorn and cinnamon flavors pretty much have some toxic profile. But the finding out how to regulate flavors in a way that don't appeal to kids, but that have some appeal to adult smokers who aren't going to quit under any other circumstance, I think is one of the things that we need research on and we really need to sort out from a research and regulatory standpoint. Thank you.
Thanks, Dr. Rubelso, and thanks again to Susan and Desmond. This was a really thought-provoking topic and a great webinar, and I apologize to many of you. We did get a lot of questions, and I apologize we weren't able to get to many of them, but you can feel free to contact any of the presenters or our organization at your convenience. And as Cameron mentioned earlier, there will be an email coming out to you, and this will be archived on our website so you can review the slides or listen to it at a later date. Thanks again for joining us today, and we hope that that it was a good webinar from your perspective. Thanks. Bye.